on the FDA, you say that there was a large consensus of doctors and advisors who feel like boosters are warranted and safe and effective. But then during all this, you had two top senior officials at the FDA resign during the booster conversation, that being the Director of Office of Vaccines Research and Dr. Philip Krause, Deputy Director of the office, concerned about the vaccine. So what's your reaction to that in light of boosters next week? And what does that say to the American people to have those two high-level people step down over this conversation?
Well, Emerald, what I conveyed before, and I'll reiterate, is that 8 of our top medical experts, health and medical experts, including the acting head of the FDA, Janet Woodcock, recommended we would need boosters moving forward. The American people would need boosters pending approval through a process including the FDA and ACIP. That's the process that's ongoing. In terms of differences of opinion within the FDA or other components of the federal government, that's certainly, we understand that may be the case, but in terms of the consensus view, the view of the leadership of the FDA, the view of the leadership of our health and medical experts, that was their shared recommendation because their objective and their focus is on relying on data to save lives. And data available showed a waning efficacy of vaccines after a certain number of months.
Speaking of the waning efficacy of vaccines, I do have another question about the president's COVID plan. He promised on September 9th that he was going to send 50% more supply of monoclonal antibodies to states. Yet, the Biden administration is cutting supplies in red states by 50%. So, for example, in Florida, they were expecting to get 70,000 doses this week, which they say they need. They're only getting 30,000 doses. And this is not just for unvaccinated people. In South Florida, half the people who are seeking this treatment are fully vaccinated. So, why is the Biden administration cutting these supplies?
That's not accurate, so let me give you the accurate information. First of all, we are increasing our distribution this month by 50%. In early August, we were distributing an average of 100,000 doses per week. Now we're shipping an average of 150,000 doses per week. Over the last month, though, and one thing that I think people need to understand for clarity, facts, I know you're like facts, is that monoclonal antibodies are life-saving therapies that are used after infection to prevent more severe outcomes. So clearly the way to protect people and save more lives is to get them vaccinated so that they don't get the COVID to begin with. But over the last month, given the rise in cases due to the Delta variant and the lower number of vaccination rates in some of these states, like Florida, like Texas, just 7 states are making up 70% of the orders. Our supply is not unlimited, and we believe it should be equitable across states across the country.
There's been no reports of a lack of supply, so why cut them to those states only if there's no reports
I
of
think our role as the government overseeing the entire country is to be equitable in how we distribute. We're not going to give a greater percentage to Florida over Oklahoma, nor do I think are you suggesting that. I think we have to move on.